No more medicine for the masses.
This is not a one-size-fits-all disease.
Now, treatments designed with you in mind.
It's unbelievable. It really is. That it's just for you.
From cancer to heart attacks to vitamins. Should everyone have a personalized prescription?
Due to the advanced testing, we're able to look at people on a cellular level.
Targeted therapy.
Okay guys, this is a basic overview of the paradigm shift in orthopedic rehab. We're getting a lot of interest in this area because, again, physicians and physical therapy practices are looking for additional revenue streams. So let's kind of click through this to get you up to speed. And any comments, we could just get together and talk about this once you guys review this, okay? This program is based on biochemical individuality of each patient. So basically we're able to customize diet and supplementation during the healing process or the physical therapy process. Each patient is biochemically unique, and when we set this program up, we bring in the research lab, the pharmacy, and the nutritional supplementation all under one roof. I could streamline this in about 30 days. Nutrition goes back to the beginning of time, as you can see with surgical injuries and rehab. Everybody's under stress. The food has nutritional deficiencies. We're able to check metabolic dysfunction, and now we're able to look at how the toxins in the environment are impacting the body and slowing the healing process. That kind of separates us from everybody else. Every one of the areas of physical therapy or orthopedic rehab is going to be impacted by this program. Our idea is to use it for surgical patients and integrate the regular folks going through pain management, weight loss, and slide more into the wellness arena after they come out of surgery, or we could just develop this for everybody coming through the door. Again, that's what we'll brainstorm on moving forward. Most of the patients we're dealing with are overweight, malnourished, and the aging population. All these things slow the healing process, as you know. Now we're able to customize a protocol for these folks. And not only customize it, but at one facility we could document this information. Once we document this, it'll be easy for us to utilize that information we collected as a revenue stream for our group. You guys already know the money involved in this, and there's not a lot of money spent during research, and I believe that's going to set us apart from everybody else. $849 billion. The aging population, they're all going to be needing therapies and programs. And again, I think if we focus on this and bootstrap it slow out of one facility, we'll be able to be the early adopters in this new paradigm shift. Nutritional deficiencies and ped wound healing, now we're able to track that on a cellular level. One of the studies that we brought together, we also have studies in the back of the presentation. Factors that impede wound healing, hypoxia, infection, nutritional deficiencies, hormonal deficiencies, medication, the age of the patient, and the environment and body composition. All of these things will be considered when we're developing a customized program for a client or a patient. Food. Food is number one. We could actually customize the diet for a patient. An example being, if you are not what you eat, you already absorb. Our first test looks at how well the intestinal tract is pulling nutrients out of food. If the intestinal tract is out of balance, we could rebalance the intestinal tract with simple antibiotics and then re-inoculate it with bifidobacteria and lactobacillus, and then help the body resonate. A lot of people are not absorbing nutrients from food. So again, you are not what you eat, you already absorb, and one of our first tests that we use for patients coming to the door looks at how well the intestinal tract is pulling nutrients out of food. Carbohydrates, protein, omega-3 and 6 fatty acids, every one of these we measure, every one of these impact the recovery and the healing process. An example is, if you have an imbalance of omega-3 and omega-6, which many people do, it will add to the pro-inflammatory response in the body and slow the healing process. One of our further blood work tests we look at is something called C-reactive protein. Will tell us about the inflammation response inside the body. We are all biochemically unique. That being said, the physical therapy centers that I contacted, some of the boutique centers that are doing really high-end work, have not even come close to offering a program like this. Every day our body needs 21 minerals, 13 vitamins, 8 amino acids, 2 essential fats. If your body doesn't get this from food, or if you don't get it from supplementation, you will mine it out of your own tissue. After surgery, the patients are in a hypermetabolic state. That's when they need this. They need the nutrition and they need the supplementation. And there isn't anybody that's dialing this in yet. A few plastic surgeons are using amino acids to speed the healing process, and they're getting a great response from the skin and surgery and liposuction. But nobody has looked at this at the orthopedic market yet. This is one of our basic tests. The center column shows us the nutritional deficiency. The right side column shows us what part of the body in the Krebs cycle is not functioning. We don't actually measure nutrition in blood, we measure nutrient-dependent metabolic functions. We measure the machinery. Chronic stress shuts everything off like a clock. Elevated cortisol, I've dealt with private military contractors, police, fire, people going into surgery that were under severe stress, and they were always slow to recover because of the elevated cortisol levels. So we measure IGF-1, insulin-like growth factor, in the center. We look at the multiple tissues that it impacts in the body, and then we adjust the program based on metabolic markers. The programs that I set up in Beverly Hills and Boca Raton that were hormone replacement programs, what we gleaned from that information is when people's IGF-1 levels were up and they were using growth hormone properly, great things happened. But 50% of the people didn't respond to the program because they weren't looking at nutrition, they weren't looking at the thyroid, they weren't looking at cortisol levels. So my job in these facilities was to educate the doctor with further testing so they could understand, pull one string in the spider web, the whole web shakes. My job was to educate the physician and get him up to speed and help him and put more tools in his toolbox, basically, to help these patients coming through his facility. Amino acids from protein, these are the areas that are affected by amino acids. From a wound healing standpoint, I mean, this is bar none one of the best tools to have to help somebody rehab quickly. These are some of the studies. People with higher testosterone levels, women with higher progesterone levels always heal better. Don't think of testosterone as building muscle mass as much as elevating something called nitric oxide on the arterial level. Keeps the arteries and arteries dilated, so more and more nutrition can get to the muscle and support the healing process. And these are the studies that you could sort of go through that we collected. Everything from the nutrition to the elevated cortisol levels. And again, this is all evidence-based medicine. What we're going to be doing is bringing it under one roof. So our other goal is not to stress out the physician in the practice where he has to see more patients, but develop a room where this could be basically run by a coach or a nurse practitioner. And we handle all the training here at my Orlando facility, and my staff will help the people with the paperwork and streamline the process so we don't have to interrupt the patient flow in the doctor's office.